Dr. Shail, you have told about the abnormal cornea. Would you like to go for any formulas which are corneal bypass formulas for the abnormal corneas, like post-RK having a 32 or more incisions?
So, to be honest, I haven't experimented much with the formulas for the past, I would say more than 7 or 8 years. The Barrett's has been our go-to, including for post refractive eyes like RK and things. And if it's an RK, I would, with whatever the Barrett shows, I would put zero point 0.5 or at least one diopter more than what the Barrett shows, and it reasonably works well. But I haven't experimented too much with the different newer formulas.
Thank you. So we go for the last talk of the session. There are lots of toric calculators available these days, and how we can integrate these in our practice. Now, when we go for any toric calculator, we have two components. One is the spherical power component, which we are deriving from our formulas which we are opting for, and second is the axis and cylindrical power of the toric lenses. Now, if it is the same, then why we have so many toric calculators? We have so many toric calculators. Why it is happening? Because we have little bit understanding about the astigmatism part. So first is the SIA part, surgically induced astigmatism. There is some newer understanding about the posterior corneal astigmatism part. There are definitely influence of effect lens position of the cylinder at the corneal plane and cylinder at the IOL plane, and certain things like a postoperative IOL tilt factor. So we will briefly go through them, and then we'll go for which are the available toric calculators for us. So for the SIA, we all know that Dr. Warren has given us this website. You can calculate your own SIA value. But the problem with this SIA is the magnitude. Typically shows the wide variation. Dr. Tejas is operating from 180 degree with a 2.4 incision. He is getting the SIA of minus 0.32, and Dr. Shail is operating and is getting minus 0.22. So there is a huge change in the wide variation in the magnitude. In the same way also in the orientation part also. Because of the better understanding with these vector analysis by the supercomputers, and we have a ray tracing technology and optical engineering system, that each and every point of the eye we can calculate about the correction on that part. So you apply this trigonometry and the vector analysis, and when we go for that, the average of these vectors represents the mean SIA value, and that is known as the centered value. So for the centered value, Dr. Douglas has given us a value of 0.1 for the 2.4 millimeter corneal incisions, or 0.12 for the 2.8 incisions. Another important part is to understand about the posterior corneal astigmatism. We all know that the cornea on the posterior surface acts as a strip vertically, so it is a negative lens. So the effect on the with the rule on the front part, it has a decrease in the total corneal power in the back part. And if it is against the rule astigmatism, the net effect will be increased in the ATR valve. So for that, Dr. Barrett and others have given us a nomogram. So suppose your front cornea is like this, you have to add or subtract according to their with the rule or against the rule. So we have so many nomograms available. Now so many machines are also available to measure the anterior cornea and the posterior cornea, like SSOCT based or pentacam based, or intraoperative aberrometry like URA, or color LED patterns. So all these machines give us a very good idea about what is the total corneal power. Now we have estimation part, so many nomograms are available and so many measurement are available. So what we should do, and what the study says, that the performance of the measured one or the estimated one are nearly similar. So there is no need to rush buy the newer equipment for a total corneal power calculation is concerned. And this is another very landmark study which shows there is not a compatibility between the different machines. Suppose I am taking a corneal power of the pentacam, and suppose I am taking a corneal power of IOLMaster 700. Even though both are not the equivocal power, there is some variation between these two technologies. So that is again an issue for us for the consideration of the total corneal power. And another important to understand about the ELP effect influence on the cylindrical power. Usually all toric calculators initially will consider the fixed ratio. You want to correct the corneal power 1.5, then the IOL correction is around 2.25. The fixed ratio was considered as 1.45 to 1. But suppose you have a high myopic patient or a hyperopic patient, this ratio change. Rather than 1.45 to 1, it's converted to 1.2 or 1.75. In the same way, even if you have a flat cornea or even if you have a steep cornea, the corneal toricity ratio is changing. So you should have that consideration in your toric calculator that when you are going for that one. So which calculator one should use when you are selecting the toric calculator? Calculator which is using the centered value to represent the SIA value. Calculator which incorporates the PC automatically whether it is a predicted one or a measured one. Calculator which is considering the variable toricity ratio which is inbuilt required. And lastly and foremost, it should calculate the spherical power using the advanced formula. Because whenever you go for any company's formula, suppose you are going with the Johnson formula, Johnson toric calculator, or you are going for the Alcon toric calculator, you have to get the spherical power from your optical biometry or your immersion scan. So actually you should have an incorporation of this kind of advanced formula in the toric calculator, so you don't have to get it from the other instruments or other versions, older versions. So we are going for the different calculator which is available at present is the Alcon toric calculator, which has another two beneficial about the Barrett and the Olade, and also it can give the predicted and the measured one also. The only problem is you have to get the spherical power from the other machine. The same way Barrett toric calculator which is available online freely, it also can be used as an homogram base or the measured value. And another advantage of the Barrett toric calculator, you can have a mean of 3 different kinetometries. Suppose you have 3 machines, you have a optical biometry, you have a pentacam, or you have a auto-K. You can get a mean of all of 3 kinetometries for the measurements. The Kane toric calculator, which is very much popular nowadays, this is based on the theoretical optics, which is also both the regression and AI based. This is very important to understand. When you are using the Kane formula, Dr. Kane has suggested use a SIA of the 0 when you are going for the temporal incidence less than 2.75. Usually we are putting our own SIA and then it will give a erroneous results. The next is the EVO toric calculator, which is coming up very fast because it is a thick lens based formula. It has a incorporation of the SOS biometry, sum of segment biometry also, and it also takes an account of the lens toricity surface, whether your toric lens is the front toric or a bite toric or the posterior toric. It also take an account of this one, and it is also AI based also. So this is at present the most popularly accepted toric calculator, that is a EVO toric calculator. This is another toric calculator which is a Nazar and 7A toric calculator, which also gives both the comparison simultaneously. It gives the kinetometric predicted one, and also you can measure, you put the measure one. So you have a simultaneous comparison of these toric results. So now so many calculators are there. What to use? Barrett with a predicted one or measured posterior corneal power, or a Abulafia-Koch or a Kane one. Again ESC has come here to our help. They are giving online 4 calculators, Barrett, EVO, Offer, QST and Kane. All these 4 calculators are available with us online with the same WebSphere technology. You put your data, even you can optimize your parcel A constant for that also, and you will get the results. And results will be like that. You have a spherical component, you have a cylindrical component, which axis you have to implant, and you can compare all 4 toric calculators at a time, at a stretch. And you can take a printout of these into your OR also. So, lastly, and please understand about the IOD tilt factor, which is coming up in the near future. So, in summary, instead of SIA value, use the centered value in the toric calculators. Total corneal power, either predicted or measured, at present is equivocal for all the cases. Use the toric calculator, which is incorporating centered value, PC estimation, variable toricity ratio, and inbuilt spherical IOL power calculation. And upcoming toric calculators are SOS based biometry, total corneal measurement values. And nowadays the calculators are coming up with the tilt factor. The Panacea came with the tilt factor consideration recently.